Dave here, Wellness and Health Promotion Manager at DCare, and today I'm answering some of your queries that came in through our new Ask the Expert feature. One of the first queries that came in was in relation to zoledronic acid for spinal infusions for cancer, but also oncology treatment in general relating to dental and oral care. So the first number one thing I would say to you is some of those drugs are biphosphate drugs for breast cancer and for spinal cancers, as was mentioned in those questions. It sometimes can result in what we call osteoporosis of the jaw, it's also called fossy jaw, where it can result in the death of the jawbone. So it can become quite chalky and we can begin to lose teeth. So what I would say to you is, number one, it can be rare, but check in with the dentist. The longer you're on the drug, the more at risk you are. Always check in with your own dentist. Generally before oncology or any cancer treatment, you would have a dental referral and the whole oral health status and any red flags would be addressed, and you'd be in a good oral health status before you kind of go into anything like chemotherapy, radiotherapy. Always keep your dentist informed of any signs or symptoms that you're having. They are part of the multidisciplinary team, and generally you should be given an oral health plan for oncology management, and that's individualised to you. Some of the things that you might experience at home, nausea, vomiting, pH changing in the mouth, we might get a lot of dry mouth, serostoma, a lot of mouth ulcers, mucositis, severe ulcers down the throat or in the mouth. There's lots of things we can do to counteract those. So again, check back with your own dentist, keep them informed, but also things like the bicarbonate soda mouthwashes, hydrogen peroxide mouthwashes, chlorhexidine mouthwashes, and there's steroid tablets that can be placed on ulcers to contact your dentist, for mucositis, for those severe ulcerations. Also, never underestimate the power of a soft toothbrush, a very soft toothbrush to brush the teeth, and a high fluoride toothpaste, anything that's about 1450 plus parts fluoride, and again twice a day. And you make sure we're cleaning out the oral cavity, especially if it's quite tender at that time, that we're cleaning it in some way, shape or form. Some of those mouthwashes can give aid and release as well during oncology treatment. I'll also say to you, the interproximal cleaning, flossing, it's very, very hard, particularly with our quality of life. Our mouth is extremely linked to quality of life, eating, speaking and appearance. So some of those things will be compromised during oncology treatment as well. So we might feel like talking sometimes, we might be able to get the meal down. Look for soft, nutritious foods that aren't kind of hard and are quite easy to swallow as well. And again, that's just linking back in with the multidisciplinary team of maybe your dietitian, your dentist and your oncology specialist as well. So thank you for listening to me today, and we'll see you soon.